Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening, everyone. I hope you are having a fantastic evening. I am Jocelyn Turner, your co host for tonight's Pause for the Truth. Joining me, of course, is none other than Dr. Rogers Kane. Dr. Kane, how are you this evening?
Okay, how you doing?
I am doing fantastic.
Good, good, good. I hope everyone else is doing as fantastic as you.
Well, you know what, Dr. Kane, I figure I am going to be as jovial as I can starting out because we're talking a pretty serious topic tonight, a serious one, but yet nonetheless very important, wouldn't you say, as we delve into mental health?
Absolutely. Weekend I attended the on Sunday whereby they were remembering those that have succumbed to COVID. And one of the things that I made sure that is that those victims of COVID, the best way to honor them which is what that event was about, honoring those who have succumbed to COVID, was to make sure we took care of their loved ones, their kids, their grandkids that remain behind and may have been parentless. Whether their grandmother or grandparents were the guardians, or whether or not it was the mom, dad, to make sure that we took care of their kids after they've given their lives. And of course, part of taking care of their kids is not only to prevent them from getting COVID, but also to help deal with the consequences of COVID as it has impacted their families. And so it's so widespread in terms of the impact of COVID, not just from sick morbidity and mortality of being sick or dying, but also from the mental health aspect. So this is a perfect we need to do this. This is a must that needs to be done. As grim as it may sound, and as what you're referencing, it still has to be discussed.
Yeah, and you know, Dr. Kane, it's so interesting because there have been a lot of terminology mentioned since the pandemic has happened. And one of them, an article I read recently, had to do with orphan children as a result of COVID. So you're right.
Exactly.
There are a lot of, I think the general public has learned more about medicine and science probably than ever before. But let me go ahead and introduce our guest panelists for this evening. We have Ms. Shabrina Thomas. She's a licensed clinical social worker, and her resume is so long, I'm going to defer it to our website where we'll put all the wonderful things about her. How are you doing, Ms. Thomas?
Thank you for having me. Have a good afternoon.
Good afternoon. And we also have Ms. Keena Mcneely. She's a registered marriage and family therapist intern. How are you doing, Keena, Ms. McNeely?
Good evening. Thank you all for having me. I'm doing wonderful.
Wonderful, wonderful. And also joining us is Ms. Katrina Taylor. She is the Director of School Behavioral Health. How are you doing, Ms. Taylor?
Yes, ma'am. I'm doing pretty good.
Yes, thank you for
Okay.
joining us.
Ms. Turner, let's make sure people understand she's her position is at the Duval County Public Schools.
What did I say? I didn't say that?
Nope.
Oh, I had her working somewhere else.
That's okay. You just stated my title. You just didn't say for whom. It's okay.
Oh, who she worked for.
Right.
Sorry about
Yes.
that.
That's okay.
That's the beauty of live broadcast. Then you get to mess up and then let the world know you messed up. And anyway, so sorry if I messed up your title, but we're going to go ahead and get started because I know all of your times are very important. And we've come up with I think a good series this month as we delve into Black youth in crisis. Miss Taylor, I'm going to start asking you. Just I'm going to be honest and frank and say, what's going on in Duval County's public schools as it relates to our children and mental health and well-being?
Well, in this day and time, we know that COVID has made a huge impact on the lives of our students' mental health. We also, have to be mindful of what it means to be mentally healthy. So that means that student is able to have passing grades and being promoted, as well as coming to school every day without any truancy issues, and also no disciplinary issues as far as their behavior is concerned. All three of those factors, when they're lacking in those areas, that's what we call early warning system indicators. So that lets us know on the behavioral health side that that student may have some needs. So when we're thinking about the school district, especially in this day and time of being engulfed in COVID over the last 20 months, nationally, what we're seeing, not just in Duval County, but nationally, we've seen an increase in depression and anxiety in our students. And that's in part due to the COVID pandemic. We've always had the two mental health diagnoses that students that are referred for mental health services in the school district has always been adjustment disorder, has always been a concern for students, as well as anxiety and depression. And so we're seeing even more anxiety and depression. Nationally, there has been an increase in suicide. Thankfully, in Duval County, we have not been impacted by that increase in suicide because we have different programming in place to address those needs in our students and families. But nationally, we've seen an increase in suicidality, those thoughts and suicidal attempts. So our students are in need of that social and emotional supports more so now than ever.
Yeah, and you said a lot. Thank you. And that was a lot. And I think the thing that people don't realize when they send their children, they make sure that they have their shoes on, they're sure they're fully clothed, their backpack or whatever they need to go to school. However, children go to school with a lot of
Yeah.
physical and physical and emotional needs that people just don't think about. And fortunately, within our school system, it includes people from various disciplines, not just the teachers. People, when they think of schools, they just think of maybe the teacher and the principal. But there are other people that make up the entire staff and faculty and all of that in order to relate to the needs of our students. I'm going to pass that on and ask Ms. Thomas. So tell me, in your line of work, and I know you work a little, work a little different, but because you are, I won't say all over the place, but I'll say that you work in a variety of settings. What have you seen related to the mental health and well-being of our youth? And I know you deal a lot with families.
I've seen a lot of increase in the number of families seeking support services. If the local companies that are here in Duval County, they're actually having waiting lists right now. So the access to having crisis stabilization right now, the best option is going through the school setting. The community agencies are waiting lists could run you about a month right now.
Wow,
Well,
really?
Yes.
Well, I wanted to, and that is astounding that waiting list is so long, and but there are so many kids in the public school. I wonder how long that waiting list is. And Miss Thomas, you can address that. But the one thing I really did want to ask, follow up to statement, if you guys have been looking at those warning signs, been monitoring them, in terms of so that you can intervene in those kids that have been affected. But with that home learning, the whole virtual learning situation, a lot of your opportunity to observe that and catch those at-risk kids as as the problem beginning to develop, they've been somewhat blunted in terms of your ability to take a look at them because they're at home and no telling what else is going on at home that you can't see. When he was in the classroom, you could see him, you could see it. What do you guys? You mentioned you had some systems in place, but give us a little insight into those systems and how that works so that we can make sure that these kids, even those that are virtually schooled, are being those their issues are being addressed.
I would recommend that the parents reach out to their insurance company and ask them for a list of providers that are in network. They can also ask for a targeted case manager to help them with finding the resources they're needing. But yes, I would just refer them back to their insurance company, ask them for a list, and unfortunately, like it's because it's full, just call different companies that are in their areas, finding out when their kids can be seen.
Also,
So
Duval County.
there you go. Go ahead. No, I'm listening. That's why.
Okay. Also, Duval County, a lot of our kids are back in school. So
Mm-hmm.
we have this program called Full Service Schools. And what that means, there are different programs within that. So that means there's a therapist at a school all the time. So we have therapists either at one school, we have therapists that, who service two different schools, but there's a therapist at the school all the time who works with the school counselor, who works with administrators, and who works with teachers to make sure that the mental, emotional, and social needs are being met of children and their families.
So, Ms. Taylor, you mentioned systems that you guys have in place, and Ms. Turner, I'm gonna let you go ahead and finish. But can you give us a little insight in terms of how those systems work, especially with those kids that are virtually, that may still be virtually learning? Ms. Taylor, can you hear us?
Also, well, I can answer that. Virtual school still has a school
Yeah.
counselor, still has they can still reach out to other agencies. I don't know how the virtual academy is really doing linking with service, because for my example, for Daniel, since I'm placed at Biltmore Elementary, what really happens is once the child has been identified of needing some extra support or services, the school counselor lets me know, then a referral is sent to a social worker within DCPS, and then I'm linked with the family. Like it's a process, but it doesn't take maybe a couple days for me to reach out to the family. Actually, 24 hours, I reach out to the family and then we start services. So even with virtual, as long as they're in contact with their school counselor, because I know sometimes parents may not even know, oh, I can talk to this person or I can go to this person. Even Virtual Academy has a school counselor who should be aware on the services that are offered.
Thank you so much, Keena. I was muted. So so while we're speaking of, Keena is one of our therapists through Full Service Schools. And so all 160 of Duval County public schools, including virtual, have access to a mental health therapist. Our highest need schools have a one-on-one therapist, which Keena is at Biltmore. That's a high need school. So she's dedicated to that school. Our second tier of schools, they're not as high need, but they have a shared therapist. So there's one therapist that provides services to two schools. And our last tier are our lowest level schools. So that means that we have a therapist that is hub based and they go out to the school to provide services pending parental consent. Everything that we do, we cannot provide the services until parents consent for services. And that is on the mental health side. However, as Keena stated, all of our schools have a school counselor. All of our elementary schools have at least one school counselor, at least two, and all of our high schools have at least three school counselors. School counselors can do what we call brief solution-focused counseling for students, while at the same time advocating on behalf of that student for that parent that may have opposition. And we see that a lot culturally, that a lot of our parents, for whatever reasons, maybe due to some trauma that they've experienced, or maybe some biases as relates to mental health or stigma, for whatever reason, they're not open to those services. Out of 100 of our clients that are referred for services by, for example, only about 58 to 60% of our parents consent for services. So there's still a noticeable gap. And so the goal of that school counselor is to continue to advocate on behalf of that student and help that parent to understand and increase their mental health literacy so they can see that this is good for their student. Our schools also have access to school social workers and school psychologists as well. So as Keena stated, the referral process, the school send the referral to the full service school social worker, who then does a brief assessment to determine whether or not that child is appropriate for services. If it's deemed that child is appropriate, then we then send it over to Keena or whomever the therapist is that serves that particular school. So we have, according to the state, we have within 15 days of the referral to assess the student. And we have within 15 days of the assessment to link that student to services.
How do you guys go about determining, that's a question from the audience, how do you guys go about determining the highest risk, those high risk or high need schools? Are they there's a particular grouping in it? Like, when we think about health needs from a physical standpoint, we think about health zone 1, and, versus 5 versus others. How do you guys do that?
So it's based upon typically around school grade. We used to call back in the day, I've been with the school district 16 years. So back in the day, we called it turnaround schools, So our highest need schools are typically those schools that are what they consider to be lower performing, because those schools typically have those students that have lower grades. We have some truancy issues and maybe some disciplinary referral issues. So those essentially are the ones that we consider to be high need. And with full service school, the great thing about us is there's no cost. There's no copay that the parent has to pay. And so there's nothing that, we preclude them for doing for accessing the services for financial reasons. We want our students to be socially and emotionally well so they can perform academically.
Yes, Ms. Katrina, tell them it's free. Tell them it's free. They get quality therapy for free.
That's right.
Free.
Well, Ms. Turner, at the risk of sounding like I'm hogging the question, I am curious. So if I'm a parent and I really need to, I have a need that I think for my child to seek mental health and maybe myself, is there some number I would dial, or do I reach out to the principal, or exactly what do I do?
Right. So the first thing you want to do, you can reach out to your principal. I often tell parents to reach out to the school counselor. 75% of our full service school referrals come from school counselors, because typically they're the person in the building that has their finger on the pulse as it relates to students' behavior and social emotional wellness. But definitely all of our principals, our assistant principals, our deans, our school counselors are all aware of the mental health infrastructure that we have in Duval County.
So, Ms. Turner, I'm going to turn that back over to you. I do recognize that I will make this plug for the school. When Parent Teachers Night comes around, please go with your child to a Parents Teachers Night so you can go on and as well as if it gives you an opportunity to discuss with their teacher and their principal, and you guys can correct me if I'm mistaken, their teachers and their principal as to what's going on with your child and maybe help you, assist you with what you think and or feel your child needs are. Ms. Turner?
Thank you. So, Ms. Thomas, I want to kind of transition over to you. So, historically, seeking mental health therapy in the Black community has been a taboo subject. Why do you think that is?
It's been a taboo subject because of the stigma, and then of course because of the comfortability, and then their ability to relate to them. Unfortunately, a majority of those in the community are not Black social workers or Black therapists. So most of the time, you're sitting in front of a white counterpart, and they don't feel like they can relate to the Black culture, if that makes sense.
Thank you. Anybody else want to chime in on that?
I think this is Ms. Taylor for Duval County again. I think we can't base it solely on race. For example, we have our therapist that was at St. Clair Evans, and St. Clair Evans closed down and went over to Northwestern. That therapist that is there is Caucasian, and she relates to those families and provides them with quality care. She always has a wait list all the time. The parents consent for services because they know that she provides. I think it's about relationship, not necessarily race, but that rapport and that relationship that therapists can build with families and that trust can open up that door to that parent consenting. So yes, I don't want to totally knock race out of it because it does play a very important part. However, I also think that relationship and rapport plays an equal part as relates to getting parents to consent for services.
I would
Well,
also like to add, oh,
go
I would
ahead.
also,
Go
No, go
ahead.
I would
ahead.
also like to add it's a culmination of things. So it's access, it's the attitude towards receiving help, it's the language that's sometimes used because when people think of mental health, they think, oh, I must be crazy, or you have to be crazy to have that, or depression is a white people's problem. So I think it's multiple things. It's also a pride or just scared, like I don't know what to expect from it, or no, there's nothing wrong. I don't want anything that goes on in this house stays in this house. So I think it's multiple things.
Yeah, and
Ms.
you
Turner,
said
can you
something.
ask Ms. Taylor? I was going to say,
You
can you ask
said,
Ms. Taylor what do they do to help some of those? She named one of the counselors that was astute in terms of being able to deal with the Black culture. Is Duval County doing something to culturalize, or not culturalize, to help some of the understanding in regards to cultural sensitivity and cultural
Yes,
understanding? What are they doing
yes.
to educate their counselors to do that?
Yes. So good question. So we do an onboarding process with the therapist, so we just don't throw them out there to the wolves. And
Mhm.
so we do have youth mental health first aid training that provides a cultural competence area that we provide the counselors with. We also provide them with an overview of DCPS policies and procedures. And we also provide them with the cultural responsiveness training. And so those are just some. We want to make sure that they're onboarded and able to provide the services to all students, that can access the services. So we do provide them with multiple counseling, not multiple trainings, not they also receive training through their various agencies. Our 5 providers are Daniel, Child Guidance, Children's Home Society, Family Foundations, and Jewish Family Services. So these are partners of DCPS. So we contract with them to provide the services to our students. So not only do we provide them with training, but their agencies are responsible for providing them with training as well.
Ms. Taylor, sorry to be picking
That's
on you a
okay. You're
lot, but
fine. You're
because I know your
fine.
time is
You're,
time is limited,
you're fine.
but I am trying to be respectful of your time, but
Sure.
and as well as questions that are being asked.
You're
So,
fine.
what does the data show on how
Mhm.
effective 6 months of service is done, and how
Very
many
good.
youth continue services after 6 months?
Good question. Very good question. So what we do, and the full service school social workers who do the initial assessment with families, we make sure that these are families that could benefit from 6 months of services. So what I mean by that is if we have students that we receive referrals on that needs long-term therapy, we refer them out to outpatient. We don't want to open up, let's say a student that has had complex trauma of repeated sexual abuse for years. That's not a student that's going to benefit from 6 months of therapy. That they need long-term outpatient therapy. Not only that, but we want to make sure we don't unpackage that trauma in the walls of the school and send them back to class. So we oftentimes refer students to outpatient once we do that assessment with the students and the family. And so with that, most I was services after those 6 months, about 10% we will have a little over, maybe no more than 2 months additionally, and as it relates to our services. So there are a few that we continue on services with, and that maybe they didn't meet all their 26 sessions because it's 6 months or 26 sessions. So maybe they need, they probably missed school or was absent or any of that. And so if that is the case, that's when we will extend past that 6 months with them.
Ms. Turner, I just wanted to make sure we got a good use of Ms. Taylor's time while she's here, but I'm gonna let you move forward.
do you think conversations on social media, celebrities disclosing their own mental health, and more Black professionals entering the field influence more Black people seeking therapy? And I'll let either of you answer that. Conversations on social media, and celebrity seeking.
Oh, that's definitely adding on breaking the stigma. I'm loving seeing, especially when black men, like black football players, I noticed that more of them are coming out about their anxiety or bipolar or PTSD. That's definitely helping because let's be honest, this Generation Z, they are all on social media. Like that's what they do. So I think it's adding a positive turnaround to it and attitude.
Thank you. So one of the things that we have not talked about, and one of the panelists mentioned it, but I wanted to ask about how does violence and trauma impact emotional or mental health? We hear a lot about racial stress and trauma, for instance. How do you think that influences or impact emotional and mental health?
I'll take this
Shabri-
one. Yeah.
Okay.
So it causes a lot of confusion for kiddos, and it also causes a lot of hurt, sadness, and anger, as well as low self-esteem. It also impacts their identity and development, and also dehumanize and demoralize a lot of our kiddos, and it also has them feeling disrespected towards themselves. So the main thing is that the racial injustice does bring a cultural, guess the best word to say is a cultural um, feeling of depression, and the only way that can be solved is just by making sure that um, you're supporting your kids, letting them know what's going on, especially with everything with I don't know, we're in North Florida, so the Ahmaud Arbery case that's going on, it's all over the news right now, having those conversations that, justice will prevail. Those conversations are important with our kids, so making sure that they feel safe and know that this is not a thing that should be happening to our youth.
Yeah, and you're right. And I think I'm reminded, not I think, I'm reminded of a couple of weeks ago. Well, last week actually, we talked about the juvenile justice system and the crisis with our Black youth, our Black kids relative to that. And some of our panelists and even some questions from the audience had related to the behavioral health issues that our youth are impacted by. So that's why I wanted to just kind of remind you that's how we really transition to this discussion, because of the discussion that we had last week about a lot of kids may be acting out and doing things that are out of the ordinary. So how would you say parents, what would they recognize in their youth to see that, oh my goodness, something is happening, this child needs some mental health counseling? How can they recognize that something may be going on? Because unfortunately, some people, it's too late. Their child has acted up and gotten in trouble, or in some instances, although it may be rare, some youth may commit suicide. But what red flag should parents watch out for?
The one major flag that I tell anybody is hopelessness. If your child is starting to express hopelessness, then that's the time that you need to start to react. Also, if you had a child that was very sociable or active and they starting to become very withdrawn, or they just starting to lose interest in things they really was excited about, or they was in programs or activities, or they had friends and they no longer talk to their friends. So those kind of things, those kind of warning signs.
And definitely,
Thank you. Anybody else?
yeah, given where their prized possessions, and seeing a lot of anger, feeling them fatigue, and a lot of sleeping. I know that we associate our young people with sleeping a lot, especially the teenagers, because they're growing. But that's also a sign of depression. If they're just not doing their normal activities, a loss of interest, like Keena said earlier, those things, and sleeping too much or not sleeping at all, calling people that they normally don't call to say goodbye. Those are just some signs and triggers as far as those that are thinking about wanting to commit suicide. I think that as parents, we need to always have open conversations with our kids. You should know your kid's life. You should know what's going on with their day. You should know how their day was at school. How are their friends how their classes are. Just have open conversations. And I know sometimes as parents we get busy and we forget to have those conversations, but do it. Even if it's just 5 minutes, and don't expect the answer good. No, pry in. That's your job. Pry in, get all the information you need from your kid. If you have a relationship with your child where it's trusting and open, they'll tell you what's going on.
Yeah, and I also like to mention at this time, I know a lot of companies, I know Baptist Health was one company that was promoting the mental health first aid. I know, many of us don't have that mental health background, and people will say, well, I didn't know, I didn't realize something was going on. So just want to give that plug and say, Google online to learn about mental health first aid. And it's also available even for youth. And the purpose of it is for you to be able to determine if someone in your circle of influence or within your circle is having some troubling issues so that you can help them seek care. Go ahead, Dr. Kane. I'm gonna let you take it from here.
All right, so I got a couple of questions from the audience. One of the things is they want to know how often are those trainings in terms of as far as training those, I guess, those individuals whom we bring into the system to help treat and monitor our kids as it relates to mental health.
So those trainings are initially at onboarding, and any other trainings that we have that's new. For example, our team is going through, our district DCPS team is going through 2 particular trainings. One is called TBRI, which is Trust-Based Relational Intervention Training. That is a form of trauma-informed care. And so we will be training our therapists in that at the beginning of the 2022 year. Also, we're doing a SIS training, which is a evidence-based suicide prevention training that's approved through the Substance Abuse and Mental Health Association, where we will be training the therapists in that as well. But trainings initially occur at onboarding, and any new trainings that we have, they will get when it becomes available.
So do you guys track the youth that are outsourced? Because you mentioned being some of those issues are outsourced to various agencies. How does DCPS or do they track those youth once they're outsourced or track the situation?
So go ahead. It seems like somebody was going to speak. Go ahead.
Oh, I was just going to say, yeah, we track them. Me personally, as a therapist, if I know someone was outsourced, I have to keep track of that documentation wise. And I also might send a quick little email saying, hey, this person was referred. I just want to make sure that, they were able linked up with services and them.
Are there any efforts to reach out to the parents, even though they may not have identified their kid being at risk? But what is the DCPS, Duval County Public Schools, what are they doing to reach out to parents to help educate them on the signs and what to look for in their child as it relates to depression? Because many of them don't know what you guys have so astutely discussed this evening, but many don't know.
Yeah, good question. So we do, partner with our Family and Community Engagement Department, and through their Parent Academy, actually is going on tonight, FYI. We have a Parent Academy called Healthy Minds, Healthy Kids. One of my specialists is facilitating. We do that Parent Academy quarterly, and it's to increase parents' understanding of what are signs and symptoms of a mental illness or a mental health condition. What resources are available in the school and the community as relates to mental health for your students. So we partner with them, our Family and Community Engagement Department. We also, through our Duval County website, the duvalschools.org/mental health. If you go there, there's resources on that webpage. We also have a dedicated Facebook page. It's DCPS BH, which is Duval County Public Schools School Behavioral Health. And on there, we put out posts post daily as it relates to mental health resources, interventions, and strategies that parents can use. So we try to tap into every area that we can as it relates to parents, because we understand that that student cannot receive the services that they need without that parental consent.
I think you guys are, I mean, as far as being online, you've done a great job. But many of the households, okay, don't have, because that was a problem, I think, with virtual learning, and you guys can correct me, but do not have access to the internet and or limited access to the internet, and or don't, some of the parents have really not been trained and or learn it as far as getting online and doing things. How can how does DCPS and how can other people that are concerned, like say my organization, Northeast Florida Medical Society, and the First Coast Black Nurses Association, how can we help in trying to get those families access to the services that you awareness? Let me put it that way: awareness of the services that you provide.
I think it's parenting. It's going to be community events and churches. That's going to be the best way that you can do it. I oftentimes have spoken at church online events through Zoom. So it's those partnerships that we have through our faith-based partners, because it is a struggle. That parental engagement is not a struggle just in schools and mental health. It's a nationwide struggle. That parental engagement piece. And so we've tried to come up with, innovative ways that we can engage families, as it relates to maybe speaking at faith-based events or participating in community-based events by having a vendor table, but just trying to address it, making sure that we try to engage families in any way possible. And so those are some ways that we do it, like I said, through community-based and faith-based events. Those typically help us to get those parents who would not or may not necessarily have access.
One of the things that I did in my practice, and I don't like, I'm not trying to hog the discussion, but it's just so close to me because I have a family member that we kind of watched him, put him on suicide watch, kid, that I really wanted to make sure that I got a good understanding. But one of the questions that I have is, and someone, actually, I didn't have the question, but someone put it to us and said, can family practice doctors include a mental health specialist in their office for direct referrals and access? I will, before I ask one of you guys to answer it, I will state that I did have a mental health specialist in my office that was well received. They were none. They were not Black, but they were well received because one of the things that the patients really liked was that they came to a place that was not designated as being a psychiatric or mental health institution. They came to their family doc and got mental health therapy, just like that person who had high blood pressure or diabetes received treatment. And so are there any programs where you guys may be looking at partnering with primary care doctors, whether they're pediatricians or family practice? Family practice are good, not to dismiss pediatricians, but we're good simply because we have parents and children that we treat. Just opposed to the pediatrician, they're specialists with the kids. We just kind of a jack of all trades and treat all. Is there any programs out there that might help practitioners as myself connect with mental health counselors and maybe have them in our offices once a week or once a month or something of that nature, for easier access to mental health services that as far as the kids are concerned? Any ideas on it?
I don't have an idea, but I will say that I have, because I work for an insurance company, I have seen an increase in local pediatricians hiring mental health providers to be a part of their staffs. And Family Care Partners is one of them. Agape Center is one of them, as well as Angel Pediatrics. They're actually starting to hire social workers and mental health providers so they can triage them, give them the treat them under crisis, and then refer them to other agencies that can take them on long term.
Excellent. I did that about 4 years ago, and it really worked well. I'm just happy to hear that you guys have it out there. For those who, I know some of them are hiring, but sometimes to hire a licensed a mental health social worker, actually pay them monies to be in place. Maybe we need a joint effort with several primary care practices to share the cost of one. That's something that we may have to deal with, but so I appreciate that. Appreciate you guys at least looking out and looking toward community services, i.e., in pediatric offices and family care or primary care offices to help try to find a solution with that problem. Ms. Turner?
Yeah, I just want to ask a kind of transition to a different question. How does being Black and LGBTQ impact a young person's mental health and well-being?
Ooh, that's good. That's good. Data shows that it's quite complex, Ms. Turner. I mean, I'm sure, some of the other mental health clinicians can really speak to this. But what we've seen is that our LGBTQ population have higher rates of suicide, as well as depression. And so to have that already, so you have a mental health concern, you're LGBTQ and African American on top of that, and dealing with some things as relates to that. It does have an impact on students, especially as it relates to identity, and culturally as well. So those students who are African American and LGBTQ have higher rates as it relates to those depression, as it relates to suicidal thoughts and ideations and attempts. And so those are definitely a very vulnerable population as it relates to mental illness.
Yeah, I know that was a loaded question, but I thought it was a very powerful one because I know oftentimes you see in the news a situation of someone being LGBTQ and unfortunately being victimized. So to being Black and LGBTQ, anybody else like to chime in on that?
Can I be transparent with you guys?
Mm-hmm.
I have a daughter who considers herself to be a lesbian. And as a mental health provider, I can tell her that, of course, we're here to support her. But then you also have friends and you also have family members who don't agree with the fact that, she's gay. And then that also tears, like you said, the identity down of a person because they're trying to figure out how to love themselves while other people are telling them that they shouldn't love themselves. So it's like you said, it's a lot to unpack, a very lot to unpack. But the only thing if you can do as a parent is support your child through the time that they're going to let them know that no matter what someone else thinks about you, what you think about is the most important thing.
And thank you for being transparent with us and honest and sharing. And you're right. I remember listening to the news how what's his name, Gabrielle Union and Dwayne Wade have been getting a lot of flack about his child or their child. And so, what happens within a family, in my opinion, is the family's responsibility. That family, those parents, are nurturing that young person and helping them grow and feel good about themselves because those same people who are putting them down and being judgmental or whatever, if something happens to that child negatively, then what do they say then? So to wrap your arms around your child and let them know that you love them, to me, that's the most important thing. And I'm not a therapist. I'm just saying that's just the way I think. So do young Black males suffer from mental health issues more than Black females?
Ooh.
Oh.
So here's the thing. I knew all of us are going to respond to this, and we're all Black women on this line tonight, with the exception of Doc back there. So
Thank you for that.
Data shows. I'm going to speak from a data driven perspective. Data shows that females have higher rates of mental health concern. Okay, that's just, and it is because females are more vocal. All right, it is because females are going to share their feelings, their thoughts, their emotions, what they're going through. But data also shows that males have higher rates of suicide. Okay, and so males, they're not going to talk too much. They're
right.
gonna do. They're not talkers. They're doers. And so I don't want to say that females have higher rates of depression or suicide or mental health concerns, because data shows that the result of that is suicide, and males have higher rates in that. So I'll let one of the other ladies, share.
You mean higher rates of successful suicide?
Successful suicides, absolutely. Females attempt it more. Males.
Only thing that what she said was Black men are less likely to seek treatment because of the stigma. To be a man, you must be strong, you must be tough, you don't talk about your personal issues, you're the man. So that is exactly.
You better man up.
But that goes back to parenting, right?
Right. It goes back to the lack of teaching emotional intelligence. It goes to, you always see men, I get angry. And then we all know anger is a secondary. So that's not what you felt first. So it always goes back to that. Yeah, you see men are just, it'll manifest into anger, but it's actually, yes, my feelings were hurt. This is what I've been going through. My mind has been heavy. And I can even see elementary school boys, they do it all the time. It takes me a lot of time. They be angry, fighting, and then it takes me about an hour to break down and say, well, I'm sad because my mama screamed at me this morning and my day has just been bad ever since. So you have to take patience. I wouldn't say females or males, they feel it. One feels it more, one has more problems with it. I just say one is open to getting help versus the other more.
Yeah, that you always hear that proverbial saying, "Stop being a punk." So, and which is that parent or whomever may think that's a little bit kind of jovial, being funny, but it really has a great impact on those boys in terms of expressing themselves early in life and later in life. So
there was a quote that I saw. It was actually today, and it speaks to the conversation that we're having right now. And the quote said, "Anger is the bodyguard for sadness." Mm-hmm. And Black men, a lot of times they express themselves, the emotion that they know is anger. And if we really peel away at that, there's sadness at the bottom of that anger, and a depth of that anger. And it's just, they're protecting and shielding themselves from that sadness through anger.
Mm-hmm. So you guys you've really done a good job in terms of identifying that. What about, as one of our audience members, are we teaching any social emotional courses, some type of mental health courses in our schools to our kids?
Absolutely.
Or should we?
Yes.
If we're not,
they are. It's going on.
Yeah. So we have multiple social emotional learning curriculums, is what they're called. We teach Calm Classroom in all of our elementary schools. So all 102 of our elementary schools have access to what's called Calm Classroom. And Calm Classroom is a mindfulness meditation program. It takes about 3 to 5 minutes to implement. The goal is that it's implement on a tier 1 level, and what I mean by whole school level. And so the students do a breathing exercise that's led by the teacher at least 3 times a day. So the beginning of the day, right after lunch transition, and the end of day. And that's Calm Classroom. We have 2 other social emotional learning curriculums. One is called Second Step, and that's a social emotional learning curriculum, as well as Sanford Harmony. The good thing about Sanford Harmony is that is free. Second Step and Calm Classroom does cost, so the school district does pay for that. But Sanford Harmony is free. So parents can even go online right now, download it, create an account and download it, and they can have access to that social emotional learning curriculum for their student.
You said it cost. Now, is it costing the parent? Is it
Nope.
costing the school system
Nope.
only, or both?
School system, we pay for that.
Well, let me ask you this then. If that be the case, Ms. Turner brought out a little earlier when she brought out the LGBTQ. Are we having classes on coping coping, not just the person that might be a member of the LGBTQ, but others who are not, in terms of how to, teach a culture of tolerance to other people's differences and so on and so on?
I'm raving about DCPS right now, but it is the absolute truth. So if you're ever at a school and you see a teacher's, there's a card that's on a teacher's badge, and it's like a rainbow card. It's called All In. It's ALLNIN. And so every teacher that has that card has gone through LGBTQ training essentially. It's a training that's facilitated by Health and PE Department, along with Jasmine, which is an LGBTQ organization. And teachers go through that training. It is optional, okay? But it does provide students with a safe place. You know, they provides them with a safe place where they can go if they feel some type of way, they feel taunted or teased, or they just want somebody to talk to. They'll see a teacher with that badge and they know that's someone that's all in.
And I can speak for Jasmine. Jasmine serves not only in youth, but it also serves family of LGBT or families. They do have support groups for parents as well as young people. My kiddo is 11, so she's not able to go there, but they were able to suggest me to a program called Flag, which is for kiddos that are under the age of 13 who are having identity issues.
Got it. Well, we have a question from it's a similar question from two audience members. Do they teach conflict resolution, decision making, and what do they do as it relates to self-esteem? You might have touched a little bit on the self-esteem earlier, but the nonviolent conflict resolution or conflict resolution. And then that may also lead into
So that's what social emotional learning addresses.
Gotcha.
Yes.
Okay.
Yeah. So
Also-
the social emotional
I'll say also, even as a therapist, I run groups at my school, and we do social skills, conflict resolution. I do that all the time in my groups and classroom presentations.
Cool. What about what about gang members? I don't know. I don't know how much that is an issue within the schools. I know gangs are issues within the city. I don't know how organized they are, but what about gangs and in the schools and issues that they may bring forth to the mental health of the other students and themselves?
Students are students. You know, oftentimes we don't know they're in a gang unless so there's not like a gang specific. But typically, if that student, let's say, for example, they get into a conflict at their so when it comes to like gang members, we don't know if students are in a gang unless it's reported to us. But there aren't any, like gang specific, counseling, if we're trying to, state that. Students are students, if those students are dealing with some type of mental health concern, we're going to provide them with quality care. And if that student is having, if they end up going to an alternative setting like Grant Park or Maddie B. Rutherford, then those schools have an on-site school counselor, on-site school psychologist, on-site school social worker, and therapist. So there's those wraparound services right there in those schools to meet the needs of those students.
Ms. Turner, you got the floor.
Yeah, I just want to ask one question as we near the end of the show. What new procedures, training, and decisions should institutions consider implementing in response to improving care with historically marginalized groups?
I think we have to have this discussion around trauma. I think as a community, we're not having that conversation. We talk about mental health, but mental illness impacts 1 in 5, trauma impacts 1 in 4. And so, what may be traumatic for me may not be traumatic for you. It may depend on that student's level of resilience and tolerance and grit, you know. But I think that as a community, we have to have the conversation as relates to trauma. And if we don't address the trauma, it can lead to untreated or undiagnosed mental health issues. But we really have to address trauma, and trauma can be from poverty to abuse of any kind, to being in the juvenile justice system or incarceration. It can be from multiple levels. So I think we have to address the level, the issues of trauma and how ACEs impacts, and that's our adverse childhood experiences, not only at the student level but also at the parent level. So we have to address the parental engagement or lack thereof. That's a concern that we need to address, as well as trauma within our community.
Yeah, I'm glad you mentioned the parental involvement piece, because a lot of what my kids, their behavioral symptoms, that's what's going on at home, because their parents have so much mental issues going on themselves, and that's why sometimes they can't even notice their own child's mental illness or mental issues, because they're still trying to work through their trauma or their triggers, or they just trying to get through with that. So I just wanted to piggyback off of that.
Yeah, and I'm glad you mentioned that. And coming from a public health background, I know we talked a lot about those adverse childhood experiences, and you're right. I work primarily on the adult side, and I saw a lot of folks coming to us, or that I came in contact with, that they were obviously dealing with some issues, and they had children. So I could only imagine how those children, or that family, the family dynamics were at home. Well, guess what, ladies? We're at the end of
Ms.
our
Turner,
show.
one last area, and I know we pushing on the time, but I do have to ask this: the role of drugs in the school, and the impact that they may have been having on our youth, especially with these days with the legalization of marijuana, and more possibly easier access of kids to that, especially the marijuana being high potency compared to their parents or their grandparents' generation and what they did. What are we seeing in the public school system? Are you seeing kids coming in and being affected by drug use, not just themselves, but their parents as well? A family dynamic.
Question.
So I cannot specifically speak on that, because drugs and alcohol, substance use isn't in my preview. However, what I can speak to is the programming that we have in place. So let's say, for example, if we see that a student is found with drugs or something on them, or alcohol or some type of substance, we understand that is a mental health concern, because that's what substance use is. And in the DSM, there's substance use disorder. And so we want to make sure we treat the disorder and not harm the child. What I mean by harm the child is provide them with punitive punishment as a result. We want to make sure they get the care that they need, And so we have programs such as we have programming such as SOS, which is one of our after school programs that a parent has to come. They're required to come. It is an option. Instead of the student going into an alternative school, they can go through this, these weeks of education, and the parent is required to participate along with the student to educate them and provide them with knowledge, not only around substance use, but around, what are some other ways you can cope? How can we resolve conflict? How do we increase our social skills? So it's just not around, nighttime substance abuse. That's the name of the program, nighttime substance abuse. But it's around equipping that family so we can find alternative ways of coping as relates to drugs and alcohol. Because typically that's what it is. They're coping with depression. They're coping with anxiety. They're coping with stress. And that's just their way of coping by trying to mask it through drugs or alcohol.
Sounds like adults.
Right. I don't specifically work with with drugs and alcohol, I will refer families to Gateway Community Services. They do a good job. They do inpatient as well as outpatient treatment for drugs and alcohol abuse.
Well, Ms. Turner, you're on.
Yeah, I think we had a very lively discussion. Our panelists are obviously the experts in the field and come from various perspectives. Sending our children to school every day is, we want to make sure that academically they're doing okay. But I think the message that we got tonight is there are some good folk out there who are also responding to their behavioral health needs as well. So I will just go public and say thank you all for your wonderful dedication, and would like to ask if each of you would like to give your final thoughts on today's topic. And I will start with Keena.
Oh, first of all, thank you all for having me on your podcast. It was such a treat, a honor, and I really enjoyed myself. It made this Tuesday different but fun. My last thing I would say is just there's a lot I could say about this, about mental health, but just try to take care of yourself. I know we're still in this pandemic, almost 2 years in it. So give yourself grace. Take care of yourself. Know it's okay not to be okay.
I'm so glad you said that, because I didn't say the word COVID, I don't think, one time tonight, and I seem to say it all the time. So thank you for letting people know that, because you're right. As we have conversation with one another, we forget to take care of ourselves. And how about you, Shabrina?
Ms. Taylor said it best earlier. We had been through a pandemic for the last 20 months. And for our kids, they had been on virtual schools for a long period of time. So they're kind of getting back to readjustment. You can almost say they took a year out of socialization. Take time for your kids. Have conversation with your kids. Talk to them, and make sure that they're okay, and make sure you're okay. And always make sure that your mental health is just as important as a parent, as well as your children's mental health. So if you're not healthy, you can't be healthy for your kids. Mm-hmm. So definitely take care of yourself. And then I also want to make sure that I let you guys know that a lot of insurance companies out there do provide caregiver counseling sessions. It's not a lot, but it is out there. And if you have an employer, reach out ask them for your EAP programs. Mm-hmm. Those programs are free counseling sessions as well. They do mostly EAP programs not only cover parents, but they cover families. They cover anybody in the household that needs some therapy. So definitely reach out to your employers, your insurance companies, find out what resources they have to help you with caring for yourself and your children.
I'm so glad that you mentioned that, because a lot of people, they don't remember that the employee assistance program is available for them, and even their own insurance providers. And you don't have to publicize it to all your colleagues when you want to seek those services. Matter of fact, you don't, sometimes when it comes to your insurance carrier, you can just call them directly. You don't have to go to your HR. But knowing that if you don't have insurance, that you can seek help through your EAP, because employers want their employees to show up to work healthy. Thank you. Last but not least, Ms. Taylor, your final thoughts for tonight's show?
Well, thank you. I just thank you for this opportunity, for being on this platform, to share, the great things that we have in Duval County Public Schools. Furthermore, I understand that as a school district, we cannot do this alone. It is the collaboration through the various partners. Schools were created to educate students, to graduate them, to matriculate into the workforce or higher education. And so with that, we've seen an increase over the years in social and emotional concerns. So we understand that the collaboration through partnerships is the only way that we can ensure that our students are socially and emotionally well. I would also like to say that I understand, and I know that we have a superintendent that understands that we cannot have the A schools or the B schools or the C schools that we have. So we cannot, try to increase the academics without addressing the social and emotional concerns that our students are walking into the schools with every single day. So I thank you for having this platform available for us to share, for us to be thought partners through how we can increase mental health literacy and access within our community.
Thank you so much. And you're right. There are resources out there, and we definitely want our families to take advantage. Dr. Kane, what about you? What are your final thoughts regarding tonight's topic?
Well, as you can tell, I probably got a little excited this evening because I see such a need to get an understanding as a provider of health. We really have been focusing on physical health in our community, especially as COVID the pandemic has really stricken our community and brought it. It didn't break us, but it does kind of have us bending our knees quite a bit. And that we need. I've had a family of 6, and 4 of them died, leaving a 12-year-old behind. And I've heard other horror stories about the same. And so I really have concern as to what is available for our kids in the public school system. I wanted to make sure when I ask about mental health at your urging, that when we had the discussion about mental health, that we try to provide as much information to get. It's a starting point. This is not the end all to this discussion, but it is a starting point by which organizations like when I mentioned the Northeast Florida Medical Society, First Coast Black Nurses, the Black social workers. I'm gonna screw up their name, but the Black social workers and their organization, where we can try in partnership with the Duval County public schools, and I'm in hope or desire that there is an easy access line for us to start a partnership with the schools in terms of what we can do to help make our kids safer, and to by providing them the help that they need in a timely fashion, and especially as it relates to those professionals like the people we have online, can help us matriculate through this very difficult, problem that we're seeing with our kids. My kids are older, but I do what one of our panelists says. I still talk with them and reach out to them to find out what are their needs and express to them how I'm feeling and asking them how they're feeling. So I really appreciate you guys coming in and helping us get the audience to understand. We don't want this to be the last that we talk about mental health. Actually, it's just the beginning. And we're want to make sure we ask you guys to come back and join us at another session. And I really, really thank you for appearing this evening.
Thank you, Dr. Kane. And as Dr. Kane said, thank you to all of our panelists tonight. Mental health is not a topic that a lot of people like to discuss, but it's such a very important topic. And again, a lot of us have heard medical terminology, and there are more citizens who have not been in the health professions who've learned more about medical terms and scientific things this past 20 months. But I think one thing that we gathered from the discussion tonight is we need to have the conversation about mental health and well-being. We need to pay attention to things that may seem out of the ordinary for our family members, not just for our children. This month, we've delved into the subject of Black youth in crisis because we realize that there are some things going on in our families, and we wanted to have this discussion. We are going to wrap up the series on next Thursday as we talk about solutions to our Black youth in crisis. And we heard some solutions tonight. So thank you all for joining us for Pause for the Truth.
Thank you for tuning in today to Pause for the Truth. We hope that you gain more knowledge about today's topic and that you will tune in next time to hear about what's trending and what you can do We help make life a little less complicated for you and your family. Growing our presence allows us to reach more people, so we need your support. Visit our website at www.pauseforthetruth.com. Like us on Facebook, tweet us on Twitter, link us with LinkedIn, but most of all, download the Podbean app to your mobile device and become a follower of Pause for the Truth. We have dedicated our careers to sharing knowledge. Now we ask you to pay it forward and invite others to Pause for the Truth. You can email question or show topic recommendation to us at info@pauseforthetruth.com. We would also like to give a hearty thank you to our behind-the-scenes technology engineer, Mr. Tyrone Jackson. You can contact him for your technology needs at www.calltyrone.net. Until next time, stay well, stay safe, and always remember, take time out to pause for the truth. This has been Dr. Rogers Kane and Ms. Jocelyn Turner signing off until next week. Good night.